the worst things they were facing in their life. They had to choose between medicine and food. They couldn't find doctors. They didn't have health care. And the reason that I was reading these letters is I was working in the Clinton White House in Bill Clinton's first term, and Hillary Clinton had just been appointed to basically fix health care. So I was working on her team. And thousands of people would write to Hillary Clinton. I think she must have asked for that, and basically say, I need you to understand what it's like for me. I need you to see really what's going on in America and what it's like for me. And so I would read those letters, and I would cry often. They were just such heartrending letters. But then my job was to bring those people in, some of the best people in, to testify about their stories, so that the people writing policy could actually hear from real people who were facing these problems every day in their life, and that the policymakers were not making policy in a vacuum. So I was already into politics at that point, but that just supercharged me. I loved this idea that everyday people could have a voice in shaping public policy. And that's what I've spent my life doing ever since then. So, of course, when our country began, everyday people did not have a voice at all. And we heard a little bit about this from our earlier speaker. And it's really kind of interesting when you think that the Founding Fathers, their big thing was all men are created equal, but women, people of color, people who didn't own land. Did you know that Catholics and Jewish people were often not allowed to vote, and that you had to be 21? So actually, in the beginning of the country, only about 10% of the population actually had a voice in government. So the path to vote, you guys have heard a little bit about it. We are celebrating 100 years of women's suffrage. That passage of women getting the right to vote, I never learned about it in school. I mean, I think I learned the date. I learned that it happened. Women got the right to vote, 19th Amendment. But when I finally heard the full story, I was really kind of amazed, because there were these women fighting this long and actually very bitter fight. And I never learned about it in school. Did you all ever learn about it in school? Okay, well, some people are nodding their heads. Well, let me just tell you, I went to school in Washington, D.C. They didn't talk to us about the struggle. And so I just want to say a couple of words, because we've already heard a little bit from Dariely about the fight for suffrage. But so this is my take on what happened. So the fight began back, before 1900, and the women were very insistent. They wanted this, but they were polite, and they basically thought, we are going to ask for this. This is our right. We've already had African American men get the right to vote, and so we want to go through the right channels. We want to look at all the, try and gain support, but they weren't insistent, they weren't demanding. And so in 1910, Alice Paul and Lucy Burns, do you all know those names? Because I had never heard those names until like my 30s. Yeah, I see you nodding, but most people don't know them. They had been working on suffrage in Britain, and they had actually been involved in a very violent fight to get women's suffrage in Britain. And when they were finished there, they came over to the States and talked to the people who were working on suffrage here, and they basically said, we need to fight harder. We need to be fiercer. And so they interrupted sessions of Congress, and they had a huge parade where they demanded people's attention. And most famously, they picketed out in front of the White House. And this was during the First World War. They were picketing a wartime president, and it was very unpopular. They got a lot of attention. They went to jail. The conditions in the jail were so terrible that they had a hunger strike, and then some of them were force-fed. And if you've ever seen anything about force feeding, it's incredibly brutal. And so you were talking earlier about Bloody Sunday. Sometimes the nation needs to see something that totally shocks them in order for us to have a change. And I do think that when the nation learned about what was happening to these women suffragettes in jail, that it really was this moment that said, well, wait a second, we need to pay attention to this issue. So We ended up getting the right to vote, as we discussed earlier. It was a good 45 years later before most women actually got the right to vote, or African American, Indigenous, any non-white women. And okay, I'm going to skip ahead. Women had a long fight to get the right to vote, but today we're doing really well. And I don't think we've talked about this yet. So right now in America, women vote in higher rates than men do. And we've actually done this since 1998. And I think that this is actually kind of surprising for people. And we actually vote significantly more than men. So women vote at 55%, men at 53%. Black women are killing it. Black women vote, 55% of black women vote, only 47% of black men. And that's true for most minority groups. Younger women vote 38%, which is really not very good, but we could talk about that later. And men are at 33%. In fact, there's only one group that where men vote more than women, and that is people over the age of 65. And men just have a tiny lead, but men vote a little bit more. So the good news is women vote more than men. We are exercising our right to have a voice in democracy. But the bad news is that when these women go to exercise their right to vote, when they go to the polling places, when they look at their ballots, really frequently the names on those ballots don't look like them. And the reason for that is that 76% of our Congress are men, and 78% of Congress are white. So often when I'm teaching, doing a training at Running Start, my organization, we'll show a picture of Congress, and it is literally a sea of white heads. Because most of the people who govern us, who make the biggest decisions that affect all of our lives, they're old, they're white, they're men, and they tend to be Christian, and they tend to be straight. And that is a really, really homogeneous group. And so what we learn over and over again, I'm sure that you all are familiar with this, if you have homogeneous decision makers, you're not going to get the best decisions. And the reason is the best decisions come when you have really diverse viewpoints, really diverse life experiences that you're bringing to that problem. And there's this great study, and I wish I had looked it up before now to remember who did it, but they took a thorny problem and they brought in a group of experts. But the experts were all the same. Let's say it's like a group of all white men. And then they brought in a group of non-experts, people who came from lots of different walks of life, who knew a little bit about the problem, but certainly not nearly as much as the first group. And everyone judged that the second group was far more successful in figuring out the solution to the problem, the best solution. And yet, when you look out at our government, that's not at all what is happening today. I frequently get to I speak to students all the time. I go around the country and I speak at colleges and universities, law schools, and I also get to speak to international groups. And I always ask them the question, so how do you think America is doing in terms of getting women into politics? They all say we're doing great. I mean, the Americans tend to say, well, of course, we're doing fantastic. We've seen the headlines. 2018 was the year of the woman. We're doing fantastically. And America's number one, right, in everything. Yesterday, I had such a cool experience. I went to speak to a group of women from the Middle East, from Chad and Iraq and Sudan and Jordan. Some of them were parliamentarians. One of them from Iraq was a police officer, a female police officer. And we were talking, I asked them this question, and they all said, well, you must be much higher than our countries. Well, those Middle Eastern countries actually are worse than us, right? But most people assume that America is at the top of the list of countries if you're going to look at the rest of the world. And in fact, at the top of the list of countries who have the most women in their political systems, Rwanda, and then you have Bolivia, and you have Cuba, and then you have all those Nordic countries, and then way, way, way down the list, it fluctuates because new people get elected all the time, you have America. And we're at like maybe 76. on terms of this, the list of women that we have in political office. And I think that it is so interesting to think, we all think we're doing really well, and yet we are hovering at less than 24% of women in Congress. And even after this tremendous election in 2018, which was called the Year of the Woman, even in the states, we're only at 30%. Oh my gosh, how do I only have, this is, okay. The time is going by very, very quickly. Okay, so what I deal with is this question of, why do we not have more women in office? This is the thing that's occupied my entire life for the past 20 years. And I think that if I were to ask that group of Middle Eastern women who I was speaking to yesterday, who frankly, the cutest thing that they said, I talked for a while and then one of them interrupted me and she said, wait, so you all have a patriarchy too? And I was like, yeah, we have a patriarchy too. So what they think, and what a lot of people think when you tell them that we really don't have enough women in government, is they think it's discrimination. People do not want to vote for women. And you all might have seen there was a recent debate that got a lot of attention in the press a couple weeks ago. Is America ready for a woman president? Did you all see this? So I think a lot of people took that at face value. Are we ready? Could a woman actually win the presidency? And they debated it. I actually had to go on TV and debate it, and here's what I said. I said, it is an insulting question. Of course America is ready. Americans actually, when you have a male candidate and a female candidate running for office, they win at the same rates as men. I mean, think about that. So we think women have a hard time, and maybe that's why, getting elected, and maybe that's why we don't have as many in office. But in case after case, they have an equal chance of getting elected. And so the problem is that not enough women are running for office. The most fabulously shocking statistic that I saw about the 2018 election, so in 2018, we got more women into Congress than we've ever had before. So we now have 131 women in Congress, and that's if you include the women who are from the territories. And so headlines saying that we had more women voting than ever before in history. And this is true. Interestingly, in 2018, we actually had more men voting also. Everybody wanted to vote in 2018. They were really riled up. And this is more on the Democratic side, but on the Republican side as well. So out of about 1,400 candidates who ran for Congress in 2018, guess how many were women? I was actually really shocked. I'm in this field, but I saw the headlines too, and so I was thinking, well, surely, if we did so well, half of those must be women. 300 out of 1,400 were female candidates. And so, when we talk about this huge surge of women, God, it's really fascinating to see. We didn't have a chance of ever getting to 50-50 men and women in Congress because we just didn't have enough women running. And so that's the big thing that I've been studying and I've been working on. 20 years ago, I knew I wanted more diversity in Congress. I knew I wanted to be part of the people helping to get better decision makers elected. And so I started this political action committee called Women Under 40 PAC, and the idea behind it was to elect younger women to Congress. And these young women who we supported, they were really diverse. They didn't have party support. Some of them had come out of nowhere, but they wanted to run. And interestingly, one of the big reasons they wanted to run is not what you often hear from traditional candidates, which is, I want to be the most powerful person in the room and I want to have a title. They wanted to run because there were things that were deeply bothering them. They didn't see anybody in their community stepping up, and they said, I've got to change this. Somebody has to change this, and if nobody else is doing it, then I'm going to do it. So I ran the Women Under 40 PAC for 5 years, and it was great. We worked with these really young women, and then we saw so many of the women who got elected do exactly what we wanted them to do. So Debbie Wasserman Schultz and Gabby Giffords and Kirsten Sinema and Kristen Gillibrand, like so many women on both sides of the aisle, Kathy McMorris Rogers, Jamie Herrera Butler, all of these women got elected under the age of 40. And what we wanted to happen was, if they got elected early, we wanted them to stay in office and to rise. Because the crazy thing about politics is it's not enough just to get into office and be elected. You also have to have power within that body. So if you are in Congress and you're not a committee chair and you don't have power, then the issues you care about are not going to get on the agenda. And actually, I want to say just a little bit about that. I think a lot of people are apathetic about politics, and they don't understand why it's so important to care about politics or to care about getting people elected. And there are people in power who are putting together laws based on what they think is right that are going to affect all of our lives. And I'm generally an optimist about people. I feel like people are doing good things. They want to do right. So I think that the people in Congress are genuinely trying to legislate on the issues they think are important for Americans. But just like we were talking earlier about diverse decision makers, if the only people making these decisions and the only people, frankly, in Congress who are in those powerful positions in Congress where they can really get things done, if they're all coming from the same life experience, then they're not going to be representing all of our issues. I really thought about this a lot when I was a young woman. I started this work around the time that I was 30, and I had spent the first half of my life trying desperately not to get pregnant, and then I got pregnant, and then had children and had to deal with childcare. There are so many issues that young women face that, frankly, most of the members of Congress were not facing. And so one of the reasons that I started this PAC is I wanted to see more women like me, women who would intimately understand the issues that were going on in my life. I wanted to see them elected. An issue or an example of this that I saw a long time ago, back in 2001, that I think is really interesting. Does anybody remember Senator Strom Thurmond from South Carolina? So he was a very, very conservative senator who lived to a very ripe old age. But almost all of the time, Senator Thurmond voted, he's a Republican, he voted with the Republicans. He didn't break party lines. If the Republicans voted for something, he was right there. But in 2001, he voted with Democrats. And it was so interesting for me to see this. His office used to be right across from my office when I was working in the Senate, so I was especially interested in him. He voted for a stem cell research bill. And it was such a surprising act that he would vote with the Democrats. So I looked it up to try and figure out what was going on. Well, you guys can probably guess what's going on. So he had a daughter with juvenile diabetes, and he knew that stem cell research might enhance her life. It might find a cure. And so, of course he voted the right way on that bill because he had seen it with his own two eyes. He had seen it up close and personal. And so he decided that he would do the right thing and he would vote. And I think that is the reason that most of us do things. We've seen things, we've experienced it, and that's one of the biggest reasons we need to get more women into Congress. Okay, and now I'm going to have to speed talk a little bit. I ran WOOFPAC trying to get women elected to Congress for 5 years. The reason I stopped doing it is we never had enough candidates. We never had enough women under 40, and we were bipartisan. So you could believe anything, and we would accept you and support you. We never had enough women, and so I started doing research to try to figure out, so why is it that we don't have enough women candidates? Why aren't women running in the same numbers as men? What's going on? And I kept coming back to the same research. It was done by Jennifer Lawless and Richard Fox, and they actually have repeated this research a few times. It's fascinating to me. What they found was that when you polled women who were my age, in 40s, 50s, and 60s, at the top of their professional field, and asked them, would you run for office? Women would say, I don't think so. Men would say, yeah, I think I could do that. Absolutely. And when you asked women why they didn't want to run for office, you got the same reply. I think there are a lot of things we might guess would be their reasons. childcare, or maybe they weren't as connected, or maybe they didn't know as much about politics. The number one reason was they didn't feel qualified. And that really stuck in my head. I thought, if women who are at the top of their professional games don't feel qualified to run, if they don't feel like they have what it takes to be a candidate, then we've got to do something about that. And there are lots and lots of groups who work with candidates. You guys probably know about Emily's List and Emerge. There are not nearly as many on the Republican side, but there are a few on the Republican side as well. And so what they're doing is they're working with people who say, hey, I'm raising my hand, I want to run for office, I'm ready. And they train them and they get them out there. But what Running Start does is we go back to basics. We work with really young women, 13 years old are the youngest that we work with, trying to change their mindsets about what they think about their own accomplishments, what they think about who they could become. And our goal is to get them to walk out of our programs feeling qualified, understanding that qualifications they're something that anybody can get, whether you're an introvert, whether you come from a community of poverty, whether you're one of the many intersections, that you can learn what you need to know in order to run for office. And our idea is, if you talk to women at this early age, if you get them started at age 13 thinking, you know what? I can be a change maker. I can be somebody who is a powerful person who actually can make things better for the people around me, solve the problems that I see. And so I've been doing this now for 13 years, and we actually, I have to call her out. So we have an alum in the room. Catherine Ettman went through our Congressional Fellowship Program, and we have 17,500 alums now all over the country. I am so tremendously proud of them, because what we're doing at Running Start is building this army of young women who believe in themselves, who understand that they're going to face a ton of barriers. They are going to face things that are going to make them not, want to step down and just fade away, because people are harsh when you are not in that center. The center is you are a wealthy, old white man, right? That's who basically is in the center of power in America. Every step out of that center, it's harder. It's definitely harder. But what Running Start does is we get them prepared for those obstacles. We teach them about the barriers that they're going to face. A lot of the barriers are internal barriers where they say, I'm not qualified, nobody looks like me. And getting them over those barriers helps them to say, not only that they can run for office, it also helps them in every part of their lives to have agency, to realize they can be problem solvers. They can stand up and negotiate a salary. They can ask for that job that they want. It's, as the founder of this organization, the ripple effect is crazy. We're doing so many more things than I ever thought we would do. One of the things that I'm the most proud of is the women who come to our program, and this has been true since the absolute very beginning. They are the most diverse people you've ever seen. And what we do when we bring these people together who come from really different backgrounds, different ideologies, different races, religions, etc., different sexualities, different gender, we have trans people as well, we make them commune. We make them figure out the ways that they can find common ground with each other. It's something America does way too rarely, and it's something that we are especially proud of. Okay, I have so many other things I want to talk to you about. I want to talk to you about the fact that that trans people, we're struggling right now with how best to support trans people in our organization, especially as they face so many obstacles into where they fit in the women's rights feminist movement. I want to talk to you about how many of the students, when they write essays, they have to write essays to get into our training programs, write about healthcare. Healthcare is the number one issue this year. Their parents don't have healthcare. They have health issues, and they're not getting the care they need. It is, and they want to get out there and they want to change it. They want to be the people who can help with this. So, but instead of talking too much about those things, I'm going to leave you all with a call to action. Of course you have to vote. Okay, that's the first one. Everybody has to vote. I don't care if you're sick. I don't care if it's raining outside or snowing outside, or you're out of town. You've got to find a way to vote. I mean, it was a long, hard struggle for most of the people in this room to people like us to get the right to vote. We have to vote. It's the easiest, most direct way for us to have a way to impact our democracy, to have a voice in our democracy. Okay, you can probably guess that the second thing I'm going to say is, especially to the women in this room, to the young people, to the people of color, think about running for office. I think that it can seem like such a daunting thing, such a terrifying thing to think about running for office, but we live in a democracy where everybody is allowed to run for office. And the more people we have who are everyday people, people who nobody would say, oh, this person's always, they've been in line, they stood in line, they've done all the right things. The more people we have who come from different outside experiences who get into public office, the better it's going to be for all of us. And my job, every day, I will have at one of the trainings, I will have somebody come up to me and say, I'm here because I'm really interested in politics, but of course, nobody like me could ever run. I hear it so much, I should get a t-shirt that says that. And everybody can run. The Muslim woman who wore a hijab who told me there are no Muslim women in Congress or in politics I would never have anybody vote for me. I would never win. So she has just decided she's running in Queens. She's one of our earliest alums. And the people from low-income backgrounds, people who are first-generation America, who are basically saying, nobody would ever vote for me. There's nobody like me in Congress. We're seeing more and more of them run. So if you're not being represented, if you think nobody's ever going to vote for you, you need to get out there, get your voice heard, because your voice is probably who we need the most. So thank you all so much.
Okay, so now comes the really fun part, which is where we get to have conversation and ask questions and dig even deeper into these super important issues. So as you might imagine, I could ask questions all day. I will kick us off, but really what we want is audience participation as well. So I want to pick up on this idea that has come up through all of these talks, which have been absolutely wonderful. So thank you again to each of you. There's this persistent mismatch, right, between population and policy, right? I think this is what we're hearing is a major theme of the day, this mismatch between population and policy. And one way to think about that is how we look at the numbers of politicians in higher office. You know, although women are 51% of the population, there are only 101 out of 435 representatives in the House, 26 out of 100 senators, 0 out of the presidents and vice presidents of the United States so far. Mm-hmm. Even though this is the year that we've had the most women running for office, New Hampshire may indicate to us that we're going in a different direction. We'll see, it's still a tiny state. And so we do have 9 governors who are women, and we have 29% of state legislators who are women. So we're still looking at very low numbers. And I think the big question is, how does this mismatch impact policies? How does it impact priorities, right? I think we need to be thinking about, we heard a moment ago, Susannah, that sometimes people don't run because they don't think that they can, but often the flip side of that is people do run because there's something they want to change, right? And that highlights this population versus policy mismatch, and it makes us, I think, be in a place where we need to be thinking about what is it that will get people to want to run? When we hear so much passion today, right? What is it that will make women get in the game? So this is open for anybody, please.
I have a quick and dirty answer, which is if you get more women into office, more women will run for office. I think that the role model effect of the women elected in 2018, it's an incredibly diverse class. It includes an enormous number of firsts. First Native American women, first Hispanic women elected in Texas, on and on and on. And so I think they provide a great example where other people say, I could do this.
The one thing I would comment on is I think it's important to think about public service more in terms of just who's elected, but also in terms of other state and federal officials. So we tend to think, and so I'm going to be thinking just in terms of my experience, in terms of elected officials and those I'm thinking in Pennsylvania in the House and the Senate. But we have a lot of nominated people in the cabinet, and so so I'll bring it back to my experience. So I was nominated at first as the physician general. Physician general is kind of like the surgeon general, and then they figured out that that sounded cool, except I had to be confirmed by the overwhelmingly conservative Republican state Senate, also primarily old white men. And so that was an interesting experience. So I got to go, it was good for me because I had no experience with state government, so I got to meet them in their chambers and learn about the legislature. And they got to shake hands with me and an openly transgender woman and talk about public health. And so it was an educational experience for both of them. Most of them were cordial. One of them did say that although I was very qualified from his point of view, I was an agent of the homosexual agenda to my face. My first reaction, because I'm old, is I remember the song "Secret Agent," and I thought that was cool. But I didn't sing that for him. And reassured him that no, that I'm just here to do public health. But I think that by being out there, as you said, I mean, as it was a nominated position but not elected position, you educate people. And so, for a lot of time, I was the transgender physician general or secretary, and the press would do that. And what I thought was really great is when that changed, is that the Secretary of Health says get a flu shot. It was no longer the transgender Secretary of Health gets a flu shot. I always wondered if I'm the transgender Secretary of Health, who's the cisgender Secretary of Health? Because that person doesn't come to work. But I wrote it in the or quoted someone in the article that talked about from this lecture, and I think it comes down to Yoda. Is that people fear what they don't understand. Fear is the path to the dark side. Fear leads to anger. Anger leads to hate, and hate leads to suffering. Is that what you don't know about, you fear. And then if you fear it, then you're more likely to hate it. And so I think as more women are in public service, whether that's not elected or nominated, as more LGBTQ individuals, whether there's more racial diversity, and diversity from anything you want to think about in public office, that the more people get educated about it, and the more that can happen. That was a long answer.
I think it's a great question, and I think that there are probably a lot of misconceptions about what it takes to run. One that I have in my mind is that it's probably very expensive. It requires a lot of money. And we see so many candidates who are able to tap into their bucket of money, of extra money that they have to be able to run campaigns. And so for people who come from lower income backgrounds, I think that's just like an immediate barrier, that it's very difficult to conceive getting beyond that. The other thing, you spoke earlier about how your life view changed when you became a mom, and it's true. It radically changes. I recently read Michelle Obama's book, and before I read the book, I felt like I knew a lot about her life. But I was really taken aback by the fact that when Obama was a state senator, she was basically raising her girls alone. And so a career in politics is incredibly demanding. And I think that's sort of another barrier. How do I manage the demands that come with being in public service? So those are just a couple that sort of come to mind.
I don't want to be a woman essentialist, but I do think it's worth asking, too, if you think that Nancy Pelosi being elevated to Speaker of the House has made a difference in this space.
I do. I really do. I mean, when I was talking earlier about how sometimes it's not enough to get into Congress, you have to be in a position of power. I mean, she has the ultimate power. And I think that in some ways, I don't care about her politics. I'm looking at her as an example of a strong woman who is able to model for us what that looks like and to normalize it, so that the next time it happens, it's like your experience with, transgender Secretary of Health. So, she's not the woman speaker, she's the speaker, or when another woman is elected. So, yeah, I am all in favor of getting women into the highest positions possible for that role model effect, because I think it's really, really important.
So I would agree with that, and I think it's been even more important now than it was when she was Speaker previously, because I think it was tremendous when she was Speaker previously, but at that time, there was a Democratic president, a Democratic House, Democratic Senate, and she didn't stand out. She stood out, but she didn't stand out as much. She was part of this progressive process. Right now, she is a force of nature because she is, standing up against the storm that we are facing. So those pictures of her, standing up in the cabinet room, or kind of shaking her finger, or her standing up behind, ripping the speech, and whatever you think about those different issues. I'm in Massachusetts. You can say these things, I mean, she has stood out more as a bulwark of democracy because of the circumstances. She had to fight to get this speakership. I mean, having young people is great, but young people do what they do, and so they wanted to kind of supplant her, and that's what they should do. But, I mean, we are, from my perspective, obviously biased perspective somewhat, but are just so fortunate that we have such a strong person to be our bulwark for democracy.
I think generally leadership really matters, and it's something that I've learned throughout my legal career. It matters who is at the helm of an organization. When I was at the New York AG's office, there were so many strong women in positions of power, and it was just so refreshing to see. I learned so much from all of those different women. I got to experience different styles of leadership. I received lots of mentorship. So I think that there is absolutely a positive effect when you see that type of leadership.
So I want to pick up on something that you said during your talk, Dariely, and that has come up as a theme today too, which is that we are seeing renewed barriers to voting, retrenchment, as I think you put it, especially after the 2013 Supreme Court decision in Shelby County, but also after Husted versus Randolph Institute in 2018, right? And so what we're seeing is new barriers like voter ID laws, requirements for documenting proof of citizenship, database culling, what some people call purges, access cuts, hours, locations, places that people can vote. And the question that I have, given the theme of the day, is how do these kinds of barriers disproportionately affect women or anyone who faces challenges to voting? Because the numbers might make you think that women get it done, right? Women have voted in greater numbers than men for years, depending on where you're looking. Arguably, since the 1960s, women have been better at getting themselves to vote, right? So how do these new barriers create hurdles that we need to be aware of and be working on?
In various ways. And I think that there isn't enough information in the public narrative about the role that voter suppression plays in our country, and the impact that it has on turnout. For one, I think it has a deterring effect, right? We talked a little bit about the apathy that you see sometimes. And if you live in a jurisdiction where you know that it's incredibly difficult to vote, that must have an impact on the desire to get out and vote if you think that you're going to face so many barriers to begin with. So there is something to be said about ensuring that your jurisdiction is able to sort of holistically make it easier for people to access the ballot box. There are so many barriers. You mentioned voter ID laws, and there's litigation in various states, but for example, in Texas, there was litigation there that showed that the voter ID legislation disproportionately impacted Latinos. And there are other restrictions in other states that disproportionately impact Native Americans who have less access to transportation, for example, and have a really difficult time traveling far distances to get to their ballot boxes, to their polling places, rather. And so I think that these restrictions work in different ways, but it's really important to think about the populations that live in those communities and how the barriers can be eliminated so that they can have more access.
Can I just add on to that? I teach a class at American University. Last night we had a Native American speaker talking a little bit about voting rights, and she said something so fascinating, which is that I think it was in Oklahoma where she's from, in order to register to vote, you have to have a street address. But the people living on these reservations, they didn't have street addresses. I think that it was probably not an intentional disenfranchisement. It could have been, but maybe it was just ignorance. But I think that there are so many factors going into disenfranchisement that we don't even think about. And years ago, I was knocking on doors for Obama in a really poor community in Virginia, and here were people who are like, "This is the greatest thing ever! I can't believe an African American man is running for president." And I'm like, "So you're going to go vote for him?" And they're like, "Oh, I can't vote because I have to leave for my job at 5 a.m, and by the time I get back, the polls are closed." I mean, it is crazy that we vote on a work day. Who is that good for? I think that there's so many things. And my kids just went to college. They have registered to vote in the town where they go to college, but that was not an easy process. And a ton of people, because our voting age is 18, that's at such a transition period, they don't register to vote. So you lose a lot of young voters that way. So I think we need to comprehensively reform voting regulations, because all Americans should want all Americans to have the right to vote. We are a democracy.
2 points. One is I would love to say that it's not deliberate, but actually I think it's entirely deliberate. And I think that, I don't know that specific circumstance, but there was someone, I believe, in North Carolina that was recently quoted, soft mic'd or something, where it was saying it's absolutely deliberate. We'll do much better. Excuse me? Yeah, that it's being done quite deliberately, as you said, with surgical precision to enhance their voting and diminish other people's voting. The other thing that I think, we haven't talked about it. It's not as much of a health equity issue, but I think that we should not ignore the impact of social media and hacking and many IT challenges in terms of the legitimacy of voting, which is significantly under siege right now. Everybody except one specific person agrees that the voting was influenced in the 2016 election. There's one key exception to that, but everybody else accepts that, even within the administration and the Senate. I think it's something that we have to consider in terms of influences on elections.
So I'd like to ask one more question, then I'll open it up to our audience, just so that I don't hog the floor totally. But I'm being a little selfish because it's just such a wonderful opportunity. So we just celebrated the 47th anniversary of Roe v. Wade, and we had the usual polling practices, which indicated that at least 7 in 10 people polled do not want Roe overturned. We know that there is no state that has a majority of voters who want to outlaw abortion, and yet there were 300 bills introduced in the last year to at least diminish access to this medical procedure that at least 1 in 3 women of reproductive age will need to avail themselves of. And we know that there's a case before the Supreme Court, which came up earlier, June Medical Services versus G, which at least threatens a common sense understanding of what health means when states regulate in the field of medicine. And so I'm wondering how it is that women's health can still be a political trading card. I mean, we even saw this in the negotiation for the Affordable Care Act, that one of the pieces of the ACA that went by the wayside was ensuring that women would absolutely have insurance coverage for all of the reproductive health, whatever its vector, whether it meant getting access to childbearing or whether it meant getting rid of an unwanted pregnancy, right? So I'm wondering how it is that women's health is still a political trading card.
I think this relates to your other two questions and to your discussion, is that when you have a lot of old white men sitting in a room discussing women's health, you're going to get a specific perspective on this, and it's going to not consider many things that young women and older women would consider. And I think that, I mean, you could see that in terms of some of the candidates who had very interesting ideas of what women's bodies were like and about reproduction, and had absolutely no clue about even how reproduction. I felt that we should go back and give them, sex ed or something, because they just don't understand bodies. And so I think that when those people are making the decisions, those are the decisions that you get.
I was recently in Iceland. Iceland is one of the countries that does the best in the world, really in like a ton of things. They're a fabulous country. But for women's rights, they're really, really strong. And the prime minister was talking about how I was at a conference, the last time they'd had this conference a couple of years ago, they were able to brag that they had basically solved pay equity. There was no pay gap between men and women. And he said, but this time I'm coming back to tell you that now we've slipped and now there is a pay gap. And I started thinking, gosh, we never expect to slip. We think that once we have achieved these milestones, we're going to stay right there. And the truth is, we don't always march forward in history. There are plenty of times that we go 2 steps forward and 1 step back, and that we have to stay vigilant. And I think I suspect that for a lot, especially of young women who've never ever thought about their rights being threatened, that it might seem like, well, this is law. This is never going to change. They're talking about it, but it'll never change. And I think that things can change, and we have to be vigilant to make sure that we safeguard the progress that we have.
I think that's absolutely true. And there's sort of a reckoning going on within the abortion rights movement with the onslaught of all of these different laws, and the recognition that there needs to be a diverse coalition speaking out against these onslaughts. What's really troubling to me as we begin to do more work in this space is the really toxic and, quite frankly, racist narrative that you're hearing in connection with abortion, that Black women are engaging in genocide. And you have lawmakers who are explicitly making statements like that to the detriment and the stigmatization of women of color who decide to use abortion as healthcare. And so I think it's incumbent upon us to, as I spoke earlier, to really go outside of our traditional coalitions, to seek new allies, to develop new relationships, because for Black women in particular, for a lot of Black women in many states, like, abortion is not even an option. It's really hard to access. And there are other issues like the maternal mortality crisis, the infant mortality crisis, access to health care. And so the conversation around abortion is important and has to be also connected to these other issues impacting women of color.
It's even worse than you think, though, because so I've had the opportunity several times to go to Health and Human Services, and I was very pleased when they let me out, so we didn't have to have a free Rachel campaign. But so one of the opportunities is we were talking with the new head of women's reproductive health services in terms of that, and we were talking about contraception. And I mean, one of the victories of public health over the last 30 years is the significant decrease in the unintended pregnancy rate and the significant decrease in the adolescent pregnancy rate. And really, the best way to have less abortions is to promote birth control, and promote birth control among youth and Title X. Title X funds birth control and other reproductive health services such as pap smears, et cetera, for teens and indigent women. And it has been a tremendously successful program. The current administration is gutting it in terms of different rules that they are to gut Title X. And that is why Planned Parenthood now is not accepting Title X throughout the country, because they cannot follow the rules that have been set. And so, you know, I argued this point at Health and Human Services, and and said that, you know, the reason why we have had such a significant, persistent decrease year after year for 30 or more years in the unintended and teenage pregnancy rate is the access to contraception, and was told the jury was out on that. And so the idea of, it's like, well, you know, I'm an adolescent medicine specialist for the last 30 years, and it's kind of what we do, and so the jury is not out. The research is really clear, but science doesn't always rule the day. So not only is there a threatened access to abortion, there's threatened access to contraception, which is a dichotomy, and the answer will be that we are going to, if this continues, see an increase in the unintended and teenage pregnancy rates. We have seen a consistent decrease for many years.
This is troubling, too, in the Medicaid space, which we haven't really touched on yet, but of course, women are the predominant adult population in Medicaid, and the administration very recently made it so that Planned Parenthood can be excluded by states in their Medicaid programs. Now, this violates federal law, just to be clear. There's an any willing provider provision in the Medicaid Act that makes it so that so long as a provider isn't being excluded for something like having committed so much malpractice they're deemed unsafe, they have to be permitted to participate in the Medicaid program. And there are some states that have tried to exclude Planned Parenthood based on those videos that came out a few years ago, right, indicating that there might have been some misuse of fetal remains. And the Obama administration said, no, under federal law, you cannot exclude Planned Parenthood because they provide safe services for women's health. The Trump administration has just reversed that interpretation and is now allowing states to exclude Planned Parenthood contrary to federal law. So we're going to see that women who rely on Medicaid, which by the way covers more than 71 million people in the United States, so nearly a quarter of our population relies on Medicaid. Medicaid itself is a public health question, right? These are vulnerable women, people who are poor, many people of color, many people in populations that are rural. These are women who are going to have an even harder time accessing safe healthcare services in certain places now. I want to open it up for questions from the audience at this time. I have plenty more I can ask, but I want to give you an opportunity as well. So what burning questions do you have? Please, yeah.
Yes, my question is for Susannah. You talk about bringing some people to talk to policymakers to present their cases. So what are the problems they have. And I just wonder how effective this is when you think that you know that the same policymakers are meeting with lobbyists who write the laws for them or help them to write the laws. And is that really works or it's not effective?
Oh, I think that's such a good question. So they're always going to be lobbyists. Right? I mean, lobbyists are, every other person you bump into in Washington is a lobbyist. And first of all, I should just say, I was a lobbyist, but you can be a lobbyist for good. It's not just evil, right? So you can be working for the Sierra Club trying to save the planet. So it's not just bad. I think that the really great thing that the Clinton administration did was they're always going to listen to the lobbyists. They had 1 million lobbyists, but they also brought in regular people. And one of my jobs, I had a lot of really strange jobs in that job in the White House. One of them was to gather groups of experts, but not lobbyists, but just gather doctors and nurses and people who normally nobody asks, well, what do you think of this? And I do think that it was good, it was a good counter to the paid people who came in who were trying to protect their business interest. Does that answer? Yeah.
I really support the right of voting for everybody. However, when the Clinton and the idiot election came up, 47% of white women voted for him against 45% for Hillary. How is that possible? Why is that?
I hope this question is not for me. Is it for me? Because I don't know. I'm not part of that. Not that I'm not part of that. I don't know. I mean, I think here's what I really want. I want everybody to have an equal right to vote, like we were saying, so that you feel that the country as a whole is able to express their voice in an election. And maybe we feel in certain elections that that's not actually happening, that there are lots of people who feel differently, but for whatever reason, they couldn't get to the polls. I have to say, every black friend of mine says, the black women, we are the ones. In Alabama, with Doug Jones, black women have become this voting force. So, yeah. I think I should not say any more on the white woman front, but yes, it is a valid question. Yes.
We're nonpartisan, so I can't.
We're
answer.
nonpartisan too. Okay, I'm trying to. That's why I'm not saying anymore. You can. Yeah.
That's my response.
In the back.
Thank you for these interesting talks. From a public health perspective, the population health numbers for women have turned dramatically bad. Mortality rates are up, infant mortality, maternal mortality, life expectancy for white women, particularly in the Midwest, is down. And I wonder, and there's very little public discussion about all this. I wonder if these facts can be turned into mobilizing facts to get more women to run, because I think that old white men don't see, hear, or are interested in these public health facts.
Well, so you're correct. I mean, there are a number of different significant negative indicators in many different aspects. You talked about overall life expectancy had gone down. It just started to go back up again a touch this year. Maternal mortality we're the only developed country in the world where maternal mortality has been increasing. And that has been not exclusively, but almost exclusively among African American women, not white women. Where it hasn't gone down for white women, but it's been stayed pretty steady. Infant mortality, there are lots of reasons for that. I think it should be a motivating factor for people to vote. One of the issues that has affected, you mentioned, I think someone mentioned the social determinants of health. How many different things that we don't tend to think about health are health related. So, whether it's economics, whether it's transportation, whether the environment, nutrition, all of these different things affect health. One thing that has significantly impacted is the opioid crisis. So that has been front and center in terms of what I've been doing for 5 years. The opioid crisis is one of the main reasons why the life expectancy went down for everybody. It does contribute in terms of maternal mortality because we have seen an increase in overdose deaths. It's been one factor. And the opioid crisis, the origins are complex. A lot of them about overprescriptions, and we tend to concentrate on that. But there's a large issue about the social determinants of health in terms of the opioid crisis as well. If you look at in Pennsylvania, what is the line that is consistent with certain aspects of Philadelphia in terms of lack of opportunity, and certain aspects of rural Pennsylvania and the Rust Belt in terms of lack of opportunity. Some people have called those diseases of despair. So whether it's overdose deaths, whether it is suicide, and other aspects that would lead to those. So I think that that's a motivating issue for women to vote. I think it's a motivating issue for everyone to vote. I mean, to me, all the issues that are talked about in politics are health issues. So whether it's not just health care, but whether it's the minimum wage in Pennsylvania, we have a $7.25 minimum wage in Pennsylvania. The lowest allowed by law, whether it is transportation issues, housing issues, all of those to me are health issues. And I think that hopefully people will vote on that basis.
So this presidential campaign, I think some of the candidates have been focused on issues like maternal mortality, specifically as it impacts Black women. And I can't recall if it's been an issue that's been raised in previous presidential candidates. But I think that it is something that I've noticed about this campaign, and it hasn't just been one candidate. There have been a couple of candidates who have been talking about it, and personally, I find that to be very refreshing. You have candidates talking about the barriers faced by Black trans women. It's been really interesting to watch the debates and to see how the different candidates respond to the questions about race. Some have very thoughtful responses. Others just stumble through them. And I think it's just critically important to talk about the biases that infect our systems, including our healthcare system. The other thing is that voting is critically important for our courts. And one huge failure from my perspective, or success from the other perspective of this administration, has been their judicial nominations and the success that they've had in nominating and getting judges appointed to both the federal, appellate, and Supreme Courts. And these are judges who oftentimes have lifetime appointments, and they are ruling on issues that impact our everyday lives. Many of these nominees have been deemed not qualified by the ABA, and I think that is something that we really have to sound the alarm about, that voting has a direct say on who is going to be sitting in the courts and whether or not you have access to justice.
So while you think of another question, I want to pick up on this idea of economic inequality, which we haven't delved into too much so far. Women still earn 80 cents approximately on the male dollar, and depending on which women you're talking about, there's a greater divide. So for example, Hispanic women earn 49 cents on the white male dollar, Black women earn 59 cents on the white male dollar. And so we also know that women suffer, for example, the mommy penalty if they take time off for having children, raising children. And so women have less wealth, right? It's not just that they earn lower wages, but also they have less accumulated wealth and all of the benefits that come with that. So I'm wondering what your thinking is on how we can address economic inequality, which is another hugely important underlying determinant of health.
So one of the ways, I mean, I think I'm going to be a broken record. Let's elect more women, right? So that's basically what I think. But there was a great study a couple of years ago that talked about how most people vote in a partisan way. You go, and if you're a Republican, you vote all Republican on the ballot, right? But they looked at the voting records of people in Congress over this particular period of time, and they picked out some issues that were particularly pertinent to women or affected women the most directly, and then looked to see who was sponsoring and helping pass those bills that would most directly affect women. And it was not along party lines at all. Your safest bet, if you cared most about this this bundle of women's issues, vote for women, because Republican, Democratic, conservative, liberal, they're going to much more likely push those issues you care about. And I think that's actually really kind of fascinating, right? That we are so partisan, but sometimes we may be voting against our own interest as women.
I think that I'm going to go back to one of the things I said before, is just in terms of the minimum wage. So $7.25 an hour as a minimum wage in Pennsylvania, which is the lowest allowed by federal law, really puts many people under economic disadvantage, not just women. I mean, so it puts men and women and gender non-binary people, everyone at a significant disadvantage, and increases the rates of Medicaid. Right, because Governor Wolf expanded Medicaid, which is great. We have 740,000 people who have health insurance because of that. But if you increase the minimum wage, then less people would require Medicaid, and so it has lots of economic problems in Pennsylvania. And so we have been trying for several years now to increase the minimum wage, but we have to do this in a bipartisan way. And I've not been able to do it. But I think that by having such a low, and that goes back to the federal low, right? Because I mean, if the federal government raised it, then we would have to raise it.
The gap in wealth between people of color and white people is just so vast that you really need something drastic to address that. And I think if something drastic is not done, then people are just really going to be left behind. You have candidates talking about, big ideas like free education, and it's a multifaceted issue, right? It's about access to education, access to healthcare, access to good jobs, access to benefits. It's not just jobs, like a lot of gig economy jobs don't offer benefits. What does that mean for families and their economic stability? Automation of data and employment. What impact is that going to have on low-income communities? So it really, the solutions have to be multidisciplinary. They have to address all of these different facets. Under this administration, we've seen a lot of rollbacks. You were talking about pay equality. Under the prior administration, there was an initiative, or requirement rather, to have businesses report on their compensation data so that they can identify wage and pay disparities, which is a great idea because, and in the beginning part of my career, I worked as an attorney representing businesses. And I saw firsthand the value that strong enforcement had on my clients. It required them to do internal analyses, right? And so an initiative like that would require employers to report out their compensation data would prompt them to do internal analyses to see if there are gaps, and if there are gaps, to fix them. Of course, under this administration, they scrapped that. And litigation has been filed to challenge that. The EEOC has said that they collected the data for this year. They're not going to collect it going forward. And you talked about, was it Iceland? I know that there are other countries that are doing much, much better around issues like pay transparency. And I think we could learn a lot from those countries because pay is something where I think we could be doing a lot more.
Looks like we have an audience question.
Thank you all so much for being here. Really appreciate the opportunity to learn from you all this morning. This question is for Dariely, but is open to all. I was wondering if you could speak to felon disenfranchisement and some of the cyclical effects of that, and what some of the work is that's being done around ensuring that felons retain the right to vote.
So not an area of my personal expertise, but it is an issue that the Lawyers Committee is working on, particularly with partners on the ground in states like Florida. And not only on felon enfranchisement, but also just generally barriers to reentry for people who have criminal convictions. And it is incredibly important to enfranchise felons, to eliminate the cycles of poverty and to provide families that are impacted by incarceration the opportunity to fully participate in their democracies. And so I think that what happened in Florida, sort of the swell of participation and activism around that issue is heartening. And I think we absolutely have to do more of that across the country.
The concern I have with Florida is that the current administration is trying to undermine that. But
Right.
so even though actually by a referendum, if you had completed your incarceration, you were eligible to vote. What they're doing is having some subtle and some not so subtle ways that are going to prohibit that. So, for instance, if you still have fines pending, court fines pending, then you can't vote. And so they're finding loopholes to be able to continue that disenfranchisement, which I think is just not good. How's that? Be politically correct.
Additional audience questions?
Well, just related in terms, I mean, because we're talking about about voting in terms of individuals coming out of prison. I think one of the biggest things is trying to prevent people from going into prison, and one of the biggest things associated with that is in terms of substance abuse disorders. That, I mean, in Pennsylvania, as in many states, the majority of people who end up in county and even in state incarceration are related to substance abuse related crimes. So some of them are heinous and very serious, but many of them are, are burglary or robbery or something in order to get money for drugs. And so as you are able to divert nonviolent individuals who've broken the law into drug courts, or there are a lot of different names for different drug courts. I mean, the idea is not to make our prisons substance use treatment facilities. There's a lot better and less expensive ways to treat substance use disorder than incarcerating people for years. And that is one of the main reasons why legalized recreational marijuana has been one of the issues. Is I mean, we can discuss it back and forth from a public health perspective, but certainly from a social justice perspective, it makes sense to not incarcerate people for using in one state is legal into the state next to it. Now, Pennsylvania we have medical marijuana. I guarantee you, when I went to medical school, I never knew I would be the regulator of medical marijuana. That wasn't on the curriculum, but we have not done recreational. But there is a problem. We'll see what happens in the rest of the Mid-Atlantic. But one of the main reasons, in addition to economic, is as from a social justice point of view, and not incarcerating people for having an ounce of marijuana.
Just to add to that, so barriers to reentry for people, as we know, this country has a history of mass incarceration, disproportionately impacts Black and brown communities, and for people who are leaving prison with a conviction, oftentimes that serves as a long-time barrier to employment, to housing, to benefits, to so many things. And there are studies that show that for white people with convictions, oftentimes have a better chance of getting a job than Black people without convictions. So the discrimination faced by people of color in particular with convictions is really, really stark. And there are studies that have shown that people with convictions actually, from a tenure perspective, stay longer at their jobs than people without criminal convictions. And I think it's because once they get the opportunity to work, they're going to work. You mentioned decriminalizing marijuana. A lot of the mass criminalization was driven by the marijuana crisis, and as states are decriminalizing marijuana, I think it's also important, it's incumbent to figure out what's going to happen to all of the people who have convictions for marijuana possession. Are you going to automatically erase their records? Are you going to make them go through some prolonged and complex process to try and get that record cleared or expunged? Access to counsel is a huge barrier for communities of color. Getting an attorney is expensive. And we run a records assistance program where we help people in states across the country try and get their records cleared. And what we've learned is that every state has a different process. Some states make it very easy, other states make it incredibly hard, and make very few things eligible for expungement or record clearance. And so I think that this is an incredibly important policy issue, because as you're decriminalizing marijuana and you have certain people benefiting from that economically, what's going to happen to folks who have the convictions?
Hello. Thank you all again so much. I wanted to go back to voting just a bit. I work for the Boston Public Health Commission. And so one of my duties as governmental relations is like voter registration for the community and so forth. And since we work with some of our most vulnerable populations in Boston, of course we know there's huge distrust when it comes to like voter registration and just voting in general. So what do you all think are some of those methods that we can use to kind of build trust in our communities that's definitely like had a negative impact or a relationship with government?
Gosh, I'm thinking about the census right now, and how I heard that even though we know there's going to be a huge amount of distrust right now from immigrants, that there's not a lot of reassurance. There are not a lot of ads that are basically saying it's going to be okay and here's why. Yeah, I think that voting, I think a lot of people just feel like I'm out of the system. This has nothing to do with me. My vote's not going to matter anyway. And it makes me think about the 2018 election, when we got so many diverse people into office who nobody thought was going to win, and they were running campaigns that were really rogue. And the one thing that I kept hearing when people would say, well, how did you succeed? They knocked on 1 million doors. I think that the whole idea of knocking on doors is going a tiny bit out of favor. Not as many people go to that extreme effort. But imagine if, for those people you're talking about, they get a knock on the door from a candidate or even from somebody in the community saying, I want to talk to you about voting. I want to find out what issues are important to you. But I think that validating people's status as a citizen, as somebody whose voice matters in the community, I think that's so important. And probably if you have one touch, you don't need to hit him over the head with it. That one touch done the right way is going to give them a lifetime of being much more engaged.
I think representation matters, right? When I was an assistant attorney general, as you mentioned, there is a huge level of distrust between communities and law enforcement. Even if law enforcement, in my case, I was working out of the Affirmative Civil Rights Bureau, so we were trying to bring cases on behalf of the people of the state of New York to tackle discrimination. In particular, when we were working with the immigrant community, it was just very hard. It's very hard. And that was, 2012 to 2016. Now it's just even harder. And one of the things that I remember doing that I thought was particularly effective, we couldn't expect for people in the community to want to come to our office. That's daunting, right? There's a lot of security. It's a law enforcement building. So there was one time where I and a couple of colleagues, we went out to a neighborhood in Queens, an immigrant community in Queens, and we had sort of like a meet and greet event with different people from the community who had various concerns about immigration services fraud. And it's an experience that I'll never forget, because the community members, they really set the tone of that meeting, right? When we would lead meetings, we were really setting the tone and the agenda. There at that meeting, I remember just being like quiet, and I'm not used to being quiet. I was just sitting there like listening to the people from the community telling us about their issues. And only after they were done were we then, allowed to kind of respond. And it was just this huge shift in power that builds trust at the end of the day. For the census, so sort of connecting those two issues together, we Lawyers Committee, we brought litigation against the Census Bureau, challenging their hiring practices for temporary census workers in 2010. They were disproportionately excluding, without justification, people who had minor criminal convictions. And not surprisingly, it had a disparate impact on African Americans and Latinos. And we entered into a large settlement with the Census Bureau, requiring them to totally revamp their selection process so that people with old criminal convictions that are not job-related would be able to secure employment as temporary census workers. And this will be the first year that we see the effects of that settlement. I think census hiring is ramping up now. And so I think one thing that community workers and advocates can do is to encourage people from your communities to work as census enumerators. Because, as you said, it's a job that requires, I think it still requires knocking on doors, right? Even though a part of it is automated. It's helpful to have people reflecting the communities where they're going to be doing the door knocking. So that's, I think that's just one thing that we can do to try and increase the turnout for the census.
I know they still require the background checks.
Yes.
So
So they absolutely still require background checks. They worked with various consultants who have expertise in criminal justice to develop a system that is not knocking people out for unjustifiable reasons. And we can chat more about that later on if you have any questions.
So I'm hoping we can end on a hopeful note. What thoughts would you like to leave our live audience and our digital audience with as we close out our conversation?
Gosh, hopeful.
Well, I'm by nature a positive and optimistic person. I think that we have lots of challenges in front of us. We have lots of challenges this year. We'll see how that works out. But I think that overall, certainly from an LGBTQ point of view, we have lots of challenges in terms of the federal government, but we have made progress. I think that we will continue to make progress. I think in terms of women's issues. So I go back to, my mother was the only graduating female law student in 1946. And so now I'm sure that probably 50% or more than 50% of the law school class are women. I want to make it clear, I don't have nothing against old white men. I mean, in fact, 10 years ago, I was one. So it's a little, now I'm not. But things change. I think that overall we have made progress. I think we have constant challenges before us. We have always had challenges before us, and so I think we have to empower young people and be positive ourselves that we'll be able to cope with those challenges.
I graduated law school 14 years ago, almost. And in that time, and more recently, I'm just always awestruck by the talent that comes through our office, by the fellows that we get, by the interns that we get, and even by staff younger than me in the way in which they're really pushing our organization, our society generally, in a positive way. And that's what encourages me and gives me hope. As I mentioned earlier, I think it's really important for us to reach back and provide mentorship and guidance. It's a really difficult time, quite frankly, to do this line of work. It's hard to be in DC every day and see the constant onslaught of attacks, rolling back protections, impacting workers, impacting LGBTQ individuals, impacting people of color, impacting women. The good thing is, though, that I think it's forced organizations to work more closely together, to be smarter about the way we're using our resources, to lean on each other more. And that's what we need. We need broader, more diverse coalitions. And I think if we continue to do that, hopefully, we'll get to where we need to be.
Okay, so you all can't see, but we're looking at a picture, the backdrop for this event, which is a picture of the Women's March. And I've been looking at it all morning and remembering being at that very first Women's March in DC and how I felt then. I was there with my 2 children and with some other family members. It was the most incredibly, impossibly hopeful feeling being at that Women's March, even though as a Democrat, I had just seen a president elected that was really devastating for me because I was hoping we might see our first woman president. And what I felt when I was at that march was that we often rise up and get great energy when we get shaken up, which is what you're really talking about. And that's what I felt, that people were saying, okay, I may not have been paying a lot of attention up until now, but I am paying attention now, and I am going to do what it takes. And maybe in the past few years, we don't always see that same level of energy, but I work with young women every day. Running Start does training programs. We do 100 training programs a year. So basically, any given day, I'm talking to young women, and the young women who I speak to, they get it. They understand that it's going to be up to them, that they need to be the ones who will stand up there and say, I'm going to put myself on the line and I'm going to try and make a difference. So I think, yes, I think it is young people, it's the coming generation who is standing up, looking around and saying it's got to be us. And that makes me feel extremely hopeful.
Be the democracy that you want to see. And on that note, thank you so much. Please join me in thanking our speakers.